we are marking World Cancer Day today, 4th of February. So I'm joined by Dr. Lois Nyanjao, Head of Coordination and Partnerships at the National Cancer Institute of Kenya. Daktari, karibu, Double O Direct.
Thank you, and good morning, Olivia and Kenya. I'm very happy to be here.
Very happy to have you and your funky hairstyle.
Thank you.
I'm gonna do that soon. When I know these dreads, yeah, that's what I'm coming for.
Do it.
Eh?
Do it.
So tell me about the work of the National Cancer Institute.
The National Cancer Institute of Kenya is a state agency within the Ministry of Health that was established in the year 2012 through an act of parliament and was given very specific things to do.
Yes.
I'm going to summarize these things. There's 4 main areas that we work in. We, number 1, raise awareness. Our mantra on a day-to-day basis is to raise awareness on cancer, generally to everyone we can reach, but we target very specific populations. We are required to target learners, individuals in disciplined forces, and individuals in confinement. So raising awareness is, I would say, our gospel on a day-to-day basis. Whatever Kenyans need to know about cancer, what causes it, how does it present, what do they need to do to seek services, where do they go to seek these services, and how can they also educate other people within their environment so that we all have a common understanding of what cancer is and reduce the misinformation that is quite prevalent.
So when you said learners, are you talking about students and pupils?
Yes.
And when you said Kenyans in confinement, are you talking about those in prisons?
Yes.
That is interesting.
Yes.
Wow.
Yes. Those are the populations that are found to be disadvantaged in accessing information. So we are required to reach these populations so that they have the same level of knowledge as a Kenyan, just like you and me.
Brilliant. So I skipped over this, and forgive me for doing so, but give me your background, okay. Dr. Lois Nyanjao, and how you ended up as Head of Coordination and Partnerships at the National Cancer Institute of Kenya.
I am a medical doctor by training, and I specialized in global health and public health, and I have worked in the Ministry of Health for more than 10 years. I live, breathe, literally bubble with passion on this group of diseases called non-communicable diseases. So these are the diabetes, cancers, heart diseases.
Hypertension.
Exactly. So I'm very passionate about these diseases and the need to prevent them because they are very preventable.
Yes.
So I've worked in the ministry for over 10 years and I've been with the National Cancer Institute for just over 2 years.
So with regards to the work of the Institute, you said it's a government agency. Yeah. Tell me about the work that he does, perhaps in partnership with private sector.
Right. Private sector are really our brothers and sisters, and we work with them very closely to advance that information on cancer to their staff, to their clients, and for instance, in hosting the National Cancer Summit that was just concluded yesterday. So there isn't a division of partners that there's private sector and then there's other government agencies. We are all a collective towards doing or tackling this issue of cancer.
And I must actually thank and send a shout out to one Dr. Githinji Gitahi. Daktari, thank you so much. It was through him that I got your contact and were able to have this interview, and actually saw him as a moderator for one of the panels that you had for the National Cancer Summit. So give me a little bit of background into how the National Cancer Summit came about.
The National Cancer Summit essentially was a platform to bring together all stakeholders who have a role to play in the response to cancer.
Why hadn't we done it before? Like, why is this the inaugural one in 2023?
When we say better late than never.
This is one of those times.
Yes, this is one of those times, and we were very happy. And the appetite for information was insatiable. And we really thank all the people who were able to come in person and those who attended virtually. And the promise by Dr. Githinji that this is not the first and the last. There will be many more to come. And really, the spirit of it is let us all come together, because we, as Ministry of Health, cannot do this alone. We need literally everyone. Ministry of Roads, Ministry of Energy, private sector, the faith, community leaders, everyone has a role to play.
Yes. Do you understand, or do you have information on the steps that came about, the timelines, the bringing about different stakeholders that led to this summit taking place this week?
Yes.
Give me,
Dr.
give me a little bit of background. And I'm taking his role, but give me. He knows that he cannot, take part in my show. But he said to you as a really great representative.
Yes. So I will say, as part of the organizing team, and we were a big team, part of the organizing team, that this was really intense. We started planning this in September 2022, and it has been boom, boom, boom all the way. It has taken very many meetings with very many stakeholders taking part in the planning and bringing together all those people that you saw in that room that day, and rallying. We didn't have the funds to do the summit. I know most people think that government has a lot of money, but
no, we were told recently, "Hakuna pesa." You can strip us, you can whip us. Hakuna pesa.
Hakuna.
Yep.
Yes. So it was really the collective effort to make it happen, and to me, it was a resounding success.
We're going to find out some of the highlights of the summit and what we can do better next time when I come back with Dr. Lois Nyanjao. As we mark World Cancer Day, we're awaiting Dr. Mercy Career and Dr. Lillian Wairum, but I am joined by Dr. Lois Nyanjao, who's head of partnerships. She's from the National Cancer Institute of Kenya. I was actually at the launch of the inaugural cancer summit at the Safari Park Hotel on Thursday, and I was flabbergasted. I was amazed by, like Daktari said, the insatiable hunger for information that we as Kenyans have, and not just medics, not just government. Walikuwa watu wengi. Double pia. So tell me about the document that you hold that you sent to me on soft copy. Nimeangalia bado. Maybe you give me a summary.
All right. Thank you, Olivia. And one of the other functions that the National Cancer Institute is mandated to do is to collect and collate data through research or through other sources on cancer that will inform strategies intended to stop the acceleration of cancer in Kenya. So one of those documents that we have been able to release, and we released this on Thursday, on the 2nd of February, is the Status of Cancer Report for Kenya.
Yes.
This report essentially puts together all the information that we have collected in the National Cancer Registry of Kenya from July 2021 to June 2022. So we are talking of a year. And in that 1 year, we were able to collect information about cancer, patients who have been newly diagnosed with cancer from various hospitals across the country. And that data was then analyzed and has been able to inform where are the most cases, say, for breast cancer, where are the most cases for prostate cancer, which then will inform those counties on how to target their investments and their programs to reduce the burden within their environment.
Where is the document available?
The document is available in the National Cancer Institute of Kenya website and also in the social media platforms.
National Cancer Institute of Kenya. That's what we need to remember. National Cancer Institute of Kenya has the information and it's correct data.
Correct.
Number one. Number two, with regards to the data that you collected, what are some of the most prevalent forms of cancer in Kenya?
Right. So generally, Kenya, I don't say produces, Kenya finds about 42,000 new cases of cancer every year. And of those, about 27,000 of them die every year. And the most common cancers in Kenya are those of the
So you're telling me 47,000 people are diagnosed, and of those 47,000 people, half of them within the year will die?
No. I'm saying that if we take a year and we do counts,
yes,
about 42,000 new cases will come up.
Yes.
And then in that
Annually,
same year, about 27,000 cases will die. So
of cancer.
27,000 may be persons who were diagnosed in previous years.
Oh, okay.
Yes.
Okay, yeah.
Yes. So the most common ones is breast, cancers of the breast, cervix, prostate. So it is reproductive organs. And then we have the esophagus and the colon rectum. Those are the top 5 cancers in Kenya.
I wanted to find out something. I was looking through my Instagram earlier today and I came across something by WHO. And it said primarily that, okay, the things you shouldn't do to avoid getting cancer, or the things you should do, like one of the things you shouldn't do is, stop smoking, limit alcohol.
Right.
Some of the things you should do is eat more fruits and vegetables, exercise more. Hey, let's be honest. Yeah? Double O does all those things.
Okay.
Naacha pombe,
Okay.
sivuti sigara, I exercise, I'm a vegetarian, eat all the vegetables. You know, I keep a good weight. Lazy made me lose 2 more because you dress na chapati, siwezi kula. But the point is, people like me still get cancer.
That's right.
So can we be honest and actually tell people that we do not know causes, or that maybe that's not all? Because as much as I love WHO, Tedros, my boy, yeah, but there's some things that are just not making sense because we're giving people hope and then they're getting cancer and we don't have answers for them. So can you just round that up briefly?
Okay. So you said it. The truth is, we don't really know what causes cancer. A few cancers we may know, like for instance, cancer of the cervix, human papilloma virus will likely, repeated infections of HPV will likely lead you to getting cancer of the cervix. But for the majority of the cancers, which are more than 100 types, we don't really know the exact cause. So we then rely on these elements we call risk factors. And a risk factor is
Genetic?
a characteristic that may predispose you, raise your chances of getting the cancer. And there are many. Some of them are, you can change, for instance, the choice to smoke or not, the choice to drink or not. But some of them, you cannot change. For instance, if there's a genetic mutation within your family line, then that puts you at higher risk.
Like the BRCA gene.
Exactly. That's why we say if there is, say, a case of cancer in your family, then you as an individual who may not be aware of your status, you need to do more frequent checks than any other person.
Okay. More with Dr. Lois Nyanjao as we await Dr. Mercy Career and Dr. Lillian Wairimu. As we mark World Cancer Day, I've been with Dr. Lois Nyanjao from the National Cancer Institute. I'm now joined by another amazing woman. Gone too soon. When I say that, I mean she's a former colleague and a wonderful, wonderful inspiration. Dr. Mercy Career, welcome to Double O Direct.
Thank you very much. It's a pleasure to be here. My maiden Double O Direct appearance.
I called you. So you've been on Double O Direct in voice.
I know.
But now you're in person.
In person, yes.
Give me a little background on yourself as a health editor, and of course now your new role.
Okay, so my journalism career was here at the Standard Group, where I started as an intern, actually a reporter. Then by the time I was leaving Standard Group, I was the health and science editor, and I think we did some amazing work on the health space, the science space we had just started, especially on issues to do with climate change, food security, and so we were able to highlight a lot of issues around health, being infectious disease and cancer that we are talking about, and any other aspects of healthcare, access, quality, affordability, governance, and leadership. And so it was an amazing time at the Standard Group and being able to serve Kenyans in that capacity.
Now that you've done what you needed to do, Mr. Lando Liomo, that was a word for you. Now back to the no, just kidding. No. But the fact of the matter is there is opportunity for growth at the Standard Group. We love that. But let me understand your transition from MD to journalist on a personal note.
Okay. So my transition was really, 1, out of curiosity, and 2, out of a desire to do more than just being a doctor and, sitting back, seeing patients every day. So I immediately after internship, I was asking myself, what more can I do with this amazing degree that I've had? I've trained as a doctor, I've been licensed as a doctor. What more can I do to make some change in society? And so,
Dr. Career, you're telling me that you got your medical license,
yes,
and then you joined the Standard Group as an intern.
Yes.
Snap.
I love it. I love it. Okay.
It was the only way to learn the art of journalism.
You see, remember millennials. Yeah, let me just pick a bone with some Gen Zs. Dr. Career joined as an intern after finishing med school, being yawa. Continue.
No, it was the only way to learn the art of journalism. Remember, I've come from, the theaters and the corridors of hospitals in the wards. So coming in here, how else do you learn how to collect stories, how to talk to sources, how to go to the field? I remember my first story was the then CJ Willie Mutunga was unveiling a statue, I think, at Uhuru Park, the Freedom Corner. And that was my first story as an intern. So it was the only way to learn the art of journalism. Now, before I now honed my skills in the health space, which is where I had been trained. And so it was an amazing role. So for the Gen Zs and the millennials, it doesn't cost you anything to lure yourself to learn something. You actually come out better because you have learned, and you never get tired of learning. We never get tired of learning. So if that is the only way that you go up, then you
Get
start.
down.
Yeah.
Get down to go up.
Yes.
I love it. Now tell me about your current role since leaving us and we're still in tears and tatters.
So now I'm at AR Hospital. I'm the business development manager. So basically what I do is take care of our customers, which is our patients. Make sure that when they come to the hospital, we give them the best possible care that they can get. Make sure that everyone we are partnering with, be it corporates, insurances, or even the community around, have the best possible care within the hospital at affordable or prices, because we know as a country we're really battling the cost of healthcare. So I'm at that point where we do the delicate balance between giving the best possible care and the most affordable of prices to customers, which is the patients who come in.
You heard it, Dr. Mercy Career. To another medic right here, Dr. Lois Nyanjao, National Cancer Institute. The report is out. You can find it on the National Cancer Institute of Kenya's website. Give me some statistics. Give me some of the information that came out of this report.
Thank you, Olivia, and hi, Mercy. Good to see you again.
Great to see you, Lois.
So there's a lot. The report has a lot, and I just want to highlight something that is very interesting that came out in that report.
May I just advise, saloon time. Mchukue report, mwende nayo saloon, musome. Trust me,
yes,
it'll go down like a ball of wax. Continue.
Right. So earlier I'd mentioned the top cancers in Kenya, and I want to talk about these three. There's, in terms of numbers, what we call prevalence.
Yes.
The top three are breast first, then cervix second, and then esophagus third. That means that of all the cancer cases in Kenya, the top three, the persons with cancer in Kenya, the top three are those breasts, then cervix, then esophagus. But guess what? The ones that unfortunately kill Kenyans the most are the same three, but in a different order.
Okay.
Esophagus kills faster than cervix and then breast.
Okay.
So it's important to know this because those of us who have had experience to know someone with cancer of the esophagus know that they go very fast. It's common, but it's ravaging.
So that's why I'm waiting for Dr. Lillian Wairimu, because she's an ENT surgeon, to tell us about this cancer of the esophagus. Dr. Lillian, umekwama wapi? Honestly, we need this very important information from you and to understand how to diagnose it, etc. But for now, you can continue, Dr. Lois.
Right. So essentially the message we have is that the burden of cancer is high and the trend is accelerating in a rate that we cannot wait to build hospitals for us to be able to catch up with it. So the message is, let us understand what is out there, which is what this report does. It tells us what is out there for us to be able to craft the right solutions, targeted solutions to tackle the cancer cases wherever we are.
Hello, Nairobi. I am Olivia Odeno, looking to dance with Kwambox. Let me tell you, it's going to be such a fire event, you wouldn't be ready. 00 Direct, Saturdays, 10 a.m., SpiceFM. Thank you to my woman in fashion for all this uncomfortableness. I'm just kidding. It's just me who wasn't ready, right? Liz Ogumbo Fashion. Find out more about this multidisciplinary creative entrepreneur. Go to lizogumbo.com. This outfit is flames. It's not even fire. It's flames. The devil was like, yo, hey, now I know what heat is like. I know heat now. I saw 00's outfit. I now understand the concept of the heat. Was it in a Bunsen burners? I bring up the Bunsen burner because I'm joined by two amazing medics as we mark World Cancer Day. They are Dr. Lois Nyanjao and Dr. Mercy Career. Now, before I let Dr. Lois leave, because she has so many things to coordinate, so many things from the National Cancer Institute, government body, government body. So lazima aende afanye hizo coordination. Yeah. So Dr. Lois, give me your parting words. Give me all the stats. I need everything to help cure cancer now. In 5 minutes.
Woo.
No pressure.
All right. No pressure. Everything that you need to cure cancer is in our hearts. We may not have put it down on paper somewhere, but it's in our heart, and we really, really want to make the story of cancer in Kenya different, and different in a positive way. So, how do we do this? I want to ask every single one of us, as long as you are 13 years and above, so mommies and daddies, for your children who are 13 years and above, be very intentional in taking the children and yourselves for a health check. Make that your mission in this month. To commemorate World Cancer Day, make that your mission to go in for a health check. For ladies, get your breast screening, cervix screening, blood glucose, blood pressure screening. For our men, get your prostate checked, get your, for all of us, let's get our colons checked, because when it is found early, cancer can be cured. So that's a message. Cancer can be cured when it is found early, and it can be found early if we go for screening. And screening is that test that you get when you go in and they check for signs or possible traces of, I would call them chemicals, that indicate that there may be cancer. So go for screening and carry with you your neighbor and your relative. Don't go alone.
Can I just give a shout out to a lady called Jackie? Jackie works for Roche.
Ah,
You know Jackie?
Yes.
Jackie, shout out to you and everyone at Roche, because your machines are helping us detect some things that we need to detect so that we can help people cure themselves of cancer early. I met her recently. She said, "Hello, I'm not one to talk." I'm like, "Yes, you're definitely the one to talk." And as Dr. Lois has said, everyone should go and get screened. I know there's a cost element involved, but sometimes you will find that there are institutions that will have it for free,
Right.
or that your insurance already covers it.
Right.
So make use of it. Ask your provider. Go to the clinic or the health facility and say, "I want to check for this."
Correct.
Don't wait until you're there on your last legs in your ende.
Correct.
Right? I heard that pancreatic cancer is also a terrible one.
It's rough. It's quite
rough?
rough. It also comes in, and when it's found, it's
Ravages.
yes.
Yeah.
Why are we afraid of pap smears as women? Why does that frighten us? Someone told me, and I'm putting you on the spot for
Yeah.
this, Dr. Lois
Yes.
Nyanjao, but
Yes.
someone told me that a lot of cervical cancers aren't being detected early because women are afraid of pap smears. Ni baridi ya hiyo kitu ama ni nini? What are we afraid of exactly?
So let's understand, what is a pap smear. Pap smear is a test that is done where some sample is taken from the lady's cervix by a provider.
Yes.
So it tends to be invasive. When I say invasive, is that they have to access the cervix for them to get that sample.
Okay.
And that has deterred ladies who may not otherwise have had that experience before, because such an experience can be had, say, when a lady is going through childbirth.
Yes.
So for ladies who have not gone through childbirth, there is a level of fear. But there's new technology. There's a new kind of test called the HPV DNA test, which a lady can collect the sample herself. She's given the test kit. She goes and collects the sample herself and brings it to the facility for the testing. That technology is a bit expensive. We are still working around the mechanics of bringing it and availing the access to all women. But science is improving things and the technologies are coming on board.
Is there any impact on a woman's virginity as a result of a pap smear? Case
None.
in point, if she isn't or she is?
If she's not had her debut,
Yes.
yes, because the access has to be gained to the cervix, and the cervix is a bit internal to the body, which is why we do not advocate for, I would say, ladies or children who have not had their sexual debut.
Okay, to go undergo a pap smear.
Yes.
Hey, ni complicated, Ajay. Parting words, Dr. Lois, before I let you go. Where are you headed, by the way?
I am headed to Kasarani Primary School,
Yes.
which is where we are commemorating World Cancer Day, and we are availing free services. There's free screening for cancer, for hypertension, for diabetes, and there's also other services. You can donate blood. I really want to call on Kenyans, please come to Kasarani Primary, donate blood, because we need the blood for our cancer patients, but also all other patients within our hospitals.
Kasarani Primary School. You will meet Dr. Lois Nyanjao. She's from the National Cancer Institute, government body. Go on to their website, National Cancer Institute of Kenya. Usiende ile ya Tanzania, utapotea. National Cancer Institute of Kenya. Go to their website. The report is out. It is a very interesting report with regards to the data that it shows about the prevalence of cancer in Kenya. Arm yourself with knowledge. And then get the HPV vaccine. Take your daughters aged 11 to 14 for the vaccine. HPV. Let's wipe out cervical cancer in Kenya. Dr. I'm going to let you go. I'm going to continue with Dr. Career. But
Thank you. Thank you very much.
are you doing this Saturday AM, the 4th World Cancer Day? This is 00 Direct. I'm Olivia Otieno with you until 2. Yep, 2 p.m. Esther Akoth Kokeo, a.k.a. Akote, will be here this afternoon from midday. She's got 10 copies autographed of her book to give away. Olivia Otieno, yeah, at OLIVIA OTIENO. Get onto the Twitter. I'm about to post something. I need you to retweet it. Just retweet, and then we'll organize for a copy to get to you. But I'm here now with Dr. Mercy Career, exemplary, Pan-African, recognized health editor, now head of business development at AAR Hospital here in Nairobi. Dr. Career, tell me about your experiences as a health editor when covering cancer and cancer-related stories.
So from the cancer NCI, National Cancer Institute report, I think it gave a lot of validity to what we saw when I was reporting on cancer or being the editor here. One, that most cancers are diagnosed late, and you could see the average age for women was 53, men is 62 years old. So people come in at late stage when there's hardly anything much that can be done. So you find it's already stage 3 or stage 4, and there's limited things that need to be done. And the thing about cancer at that stage is that the cost of treatment is high, because probably you need surgery or chemotherapy, radiotherapy. There are many cycles, and then you have to literally disrupt your life, because if you're going for chemotherapy, for example, or radiotherapy, then it means you need to, spare your day so that you're able to do something about your treatment. And then just the toll that it has on families and caregivers. And for women especially, where they have a spouse who has cancer, for example, their lives are disrupted because they become the primary caregiver. They are the person now who has to handhold this person to hospital. They have to stay with them. So if they're a working woman, then you can imagine what that happens to their productivity and what happens to the home. So you find that the devastation is just beyond the financial cost that comes with it, but also just the emotional toll, the toll that it has on women and on the families, and the strain that it has. Then the second thing was that because cancers are diagnosed late in Kenya, people scramble to go out of the country. And unfortunately, for some, they may get some relief that will give them some life, maybe for a year or two. But most of the time you find that going abroad, they agree to take you in, knowing very well that there's actually very limited things that they can do. So it ends up devastating families, because you have hope, but then you come back maybe worse than how you were before, or you come back worse financially because you have raised all of this money from everyone else to go abroad. So the key thing, and I think the message that Kenyans should have, is that screening helps. And from the report, all health facilities in Kenya are able to do screening. And if you think, say, for example, about breast cancer for women, you can do self-screening at home. I mean, you can do self-check. You're the one who knows your breast. So if anything is changing or you feel that anything is amiss, then you're able to react fast to it. On cervical cancer, now we have HPV vaccine. One of the things, and especially when government was rolling out the HPV vaccine, there was hesitance, and I got lots of calls from mothers, from parents that, isn't giving my child this vaccine encouraging morality? But if you think about it, the sexual debut in Kenya is getting lower and lower by the day. I think now we are 12 years old. So would you rather expose your child to cervical cancer other than give them that vaccine, which is for free. And so the hesitance that parents have on giving or allowing their children to get cervical cancer vaccine, I think is one of the big things that is really hampering and making it impossible for us to have as much coverage as possible. And the other thing is also that because HPV is a virus that is transmitted between sexual partners, boys should also be included in this conversation of cervical cancer, because ultimately it's passed from one partner to the other. And so the conversation about boys should also be part of the whole cervical cancer conversation.
Dr. Lois Ninjao from the National Cancer Institute was highlighting the fact that a vaccine for boys is being developed. So we're going to be able to vaccinate our boys. She mentioned something off mic from the age of about 9. Moving upwards with the HPV vaccine, which I think will be a two-pronged approach towards battling cervical cancer.
Exactly. And then for the older women now, and especially those who had a sexual debut, then annual pap smears are encouraged, and they're available in almost all facilities across the country. I think the government needs to work at making that cost affordable, so that as many women as possible are able to present themselves for a pap smear. Yes, there's a lot of discomfort, and we discussed this earlier, because it's a very invasive test. It's uncomfortable for those of us who've had it. It's one
terrible.
Of the things you actually talk to yourself before you go to the doctor for that particular test to be done. So I think we need to embrace technology, the self-testing that is there. It's available in various other facilities, but I think we need to normalize it and make it more readily available, so that more women are able to access this. Because for cervical cancer, it is curable if diagnosed early. Breast cancer is curable if diagnosed early. So why are we allowing ourselves to lose our mothers, our sisters, our daughters to something which we can control early on? So I think some of these things, we've been seeing them, we've been reporting them, and it's good to see that there's a government body, as you call it, that is handling the issue of cancer. The other thing is, when I started working as a medical doctor, we only had Kenyatta and a few pockets of private facilities that were handling cancer cases. But now we see there are more cancer centers across the country. I see today they are opening one in Garissa. And I think we are making progress as a country in terms of availing facilities that are able to screen and treat. It's not just enough to screen. And I usually see people say, we are free of cervical cancer screening, we are free breast cancer screening, or prostate cancer screening. It's not just enough to screen, because if you find that woman has suspicious cells of cervical cancer, for example, what do? You should be able to refer her somewhere within her locality where they can get help. And I'm happy to see that now we have many centers, as opposed to earlier on where people are just coming to Kenyatta, they queue for many days. Some die in the queues, but now at least we're seeing that facilities are available in different parts of the country. And I hope that as a country move more towards early detection, so that we do early treatment, so that we are able to reduce the burden. And it's cheaper when it's early diagnosed, stage 1, stage 2. Our insurances, there's some insurances that are able to cover it within the cover limit. NHIF is able to cover it, because I was seeing some of the data that NHIF is actually the one that pays the most for cancer treatment in the country. So if we're able to find it early, then it means it will be cheaper, and many more people will be able to be covered. And the financial burden that comes with treatment of cancer would be able to be reduced a bit.
2 points from that. One, lipeni ushuru, right? NHIF is actually working. Lipeni ushuru, number 1. And number 2, mapema ndio best. All right? When it comes to cancer, mapema ndio best, right? Victoria, I know you have to leave some parting words regarding your role at AAR Hospital and some of the facilities you have there.
Okay, so in regards to cancer, because that's what we are talking about, we have everything that you can think about. So at AAR Hospital, we're able to do screening. So we're able to do mammography for women. We're able to do the pap smears. We're able to do the HPV DNA testing.
I'm coming for all of those. In fact, unibook to say,
I will definitely do that.
Just book this chick everything.
We'll do that.
Kit. Yeah.
So we're able to do all of those screenings, and even for men. Sometimes we forget our men for prostate cancer, and you see men actually come when they're very late. One, because the men's health-seeking behavior is challenging. Until a woman pushes a man to hospital, it becomes difficult.
That's why single men die early.
Yes, because nobody is.
Hakuna mtu
anakushughulikia.
Yeah.
Yes. So we're able to do that screening. We have different doctors of different specialities. So if you need a breast surgeon, we have that. If you need a
surgeon,
ENT, we have all of that. A gynae oncologist, because now we have gynecologists who specialize in oncology. We have that, so that they're able to take care of you depending on, anything that you want. And then the other wellness checks, you'll find that diabetes, hypertension, HIV, people with these 3 diseases are likely to also have cancer. So we're also able to screen for diabetes and even take care of you through diabetes, hypertension, and HIV. So we have everything really under one roof, because we are a level 5 facility.
Yes.
And it's important also to say for any Kenyan hearing that we are NHIF accredited. Okay. So if you have your NHIF, we are also able to take care of you at the facility. So we welcome anyone who wants to do screening, wellness checks, and even treatment. We are able to take care of you for that.
Muko wapi?
We are located on Kiambu Road.
I thought it was a mall. I was like, in mall gani is so spick and span. Oh, it's a hospital.
It's a very beautiful hospital. You can actually just come in and walk through and just see for yourself. It's one of the beautiful architectures around there.
I've been invited by Dr. Mercy Career for my walkabout and screenings.
Yes, please do come. So we are opposite Karura Forest on Muthaiga North Road. For more location, if you're going to DCI, if you just go down the road after DCI, you'll find us there to the right of the road. It's a very beautiful facility, and we have everything there. So we welcome anyone who is in need of healthcare services, both preventive and curative.
Dr. Mercy Career, Head of Business Development, AAR Hospital. It has been an absolute pleasure having you here today as we mark World Cancer Day.
Thank you for hosting me.
SpiceFM.